When our people lived on the land year-round, only to come to the community, to the village for a couple of months, and they would return to their hunting territories. This was the time before doctors and nurses. So most of us children in my family were born in a teepee. That's my father preparing his blind for the spring goose hunt. In the background is their teepee. That's where they lived most of the time. My mother was born in a teepee like that, so was my father, and so was I. My mother there, she's splitting wood while my father is busy preparing his equipment for hunting. As you can see, both of them are very slim. And that was the hard life that they lived. My mother experienced the pain of saying goodbye to her children as they were sent to an alien world, only to return older and changed in many ways. I myself came directly from the trap line, from the teepee that you saw, and ended up in a residential school with white walls, rules, nobody to nurture me, nobody to wipe my tears as I cried. When we talk about multi-generational trauma, try to understand what that means in human forms. If you are a parent, put yourself in my mother's shoes. If you were a child, put yourself in mine. I want to mention that I started my career as a social worker, and today as chairperson, I have regular conversations with community members who are experiencing very difficult situations as they try to navigate the health system, which we all know is complex. So for our clients who do not speak French and who are very far from home and often very sick. Danielle and I both want to talk about the ways in which our organization is working to improve and create a culturally safe environment for our clients. The Cree are in charge of this organization, and we are very proud of our governance model. For the Cree Health Board, and especially for me and my fellow board of directors, good governance also means Cree governance. Iu ino CBHSSJB. As Cree, we have our own way of listening and our own way of coming to consensus. We are used to doing things using other ways, and we have become quite good at it over the years. But our ways work best for us. Iu ino CBHSSJB means that we engage our communities in a dialogue around health and social services, health and social priorities. We are accountable first and foremost to our people and our communities. The Truth and Reconciliation Commission is the broad foundation upon which we are all building a better relationship and a better future. My first recommendation to this commission is to heed to the recommendations of the Truth and Reconciliation Commission. Let it be a living document for all Quebecers, Indigenous and non-Indigenous.
So our approach is really to work in collaboration with the communities, the ministry, and all the Cree Health and Social Services entities. So work in partnership, that's what the communities want. If you look at our strategic plan, one of the things that guide us, we use the Quebec indicators for, life expectancy and so on. In our ways of the way we have to catch up with them. We have to catch up with these indicators. Like the Cree population has a shorter life expectancy than the rest of Quebec. We have more prevalence of chronic diseases. Another big point is to access the frontline services and specialized services on our service corridor. So, in our approach, it's really to bring the services to the territory. This will prevent a lot of problems because when people are sick, vulnerable, when they don't feel good, if you take them out of their environment, it's the worst thing to do. So that's one of the big points. Another important orientation is access to traditional medicine. Traditional medicine works well. It's to combine Western medicine and traditional Cree medicine. There's many things that we wanted to change in the law. The traditional food, because for the time being, it's not easy to give traditional food in the Quebec healthcare institutions because of the law. So we need community resources. We need to include that in the law because if it's not in the act, well, we have to obtain resources to implement these projects. So we want this to be included in the law.
So this one, a freighter canoe that we use up in Chisasibi. So in helping Indigenous people, and I'm kind of speaking in the terms of health, but again, you can extend this to beyond the healthcare system. It can go out into public security with the police, with social work, other public realms. So it's important to gain knowledge and respect for culture and traditions and the personal characteristics of Indigenous people, learn about their social problems and especially the residential school experience because, like I mentioned, it still has a major impact on our community lives. It's important to be aware of the higher risk of depression, suicide, and other mental health issues, including addictions in Indigenous patients and how it impacts their families. And sometimes that means dysfunctional families, violence in the home. So it's very important. And it's important also to think of your own values, beliefs, and attitudes when you're working with people of a different culture, because this is what people see sometimes. They only see the negative parts of Indigenous people living on the streets, using drugs, being violent, but what's behind all this? What are these patients feeling? Why is it they live the way they live? So cultural safety goes beyond cultural competency, which is quite a common term that we hear these days in health literature. And it incorporates the power imbalance between a patient and a practitioner. We know that historic and current policies still have major impacts on Indigenous health, and that we have a disproportionate burden of disease and lower access to healthcare services. It's important for health professionals and other public servants to learn about Indigenous cultures, the demographics, the health status of the populations they're working with, and also to respect that they may choose traditional healing. And that includes for justice, restorative justice, for example. It's important to communicate in a good way with a language appropriate for the level of education, but also maybe that'll be English. And listen, I'm glad the theme of the commission is listening, reconciliation and progress. And so we hope to help with that.